Okay. Philip mentioned some of the cavernous sinus anatomy, and we'll talk about a little bit of arterial variations or arteries in the cavernous sinus. We already went through some of that, so we'll just remind ourselves or review what we have discussed. As you can see, as you know well, cavernous sinus is covered, by this thick dura, and also its boundaries are the sphenoid bones, body of the sphenoid bone, and the pituitary fossa. It contains both arteries and veins and nerves, unlike other venous sinuses, what called sinuses. Development of this cavernous sinus is different from other venous sinus drainages. This is pictures Okudera group. Okay, Professor Okudera is one who really studied fetal development of dural sinuses. Okay? When I was fellow on some of the Japanese Meino, and my boss was Yun Peng Hwang. He was my mentor, and he was a very good friend of Professor Okudera. We used to work Yokohama. I think it was in Yokohama. He brought this whole bunch of the X-ray pictures and actual specimen pictures, and I didn't know much about it when I was a fellow. And my professor Hwang and Professor Okudera was discussing in details. I didn't know what they were saying, but I was told to make copies of all the X-rays, and I was making copies until 12 midnight. Anyway, what he taught us as a development of the venous sinus is a quite complex process, not usual venous system what we know of pure venous systems. This is actually about a 15-week or 23-week at the time of dural sinuses versus cavernous sinus. Cavernous sinus development is just loose fibrous tissues, a loose vascular network of the veins, sinusoidal venous systems. Okay? At 15 week, the carotid artery is very little present at this time. And then 23 week, it started to see arterial system in the cavernous sinus actually. Okay? The sinusoidal venous system just outlined by endothelial linings. They fuses together about 29 week and formed like venous sinuses. Okay? It does not contribute to the brain drainage in the initial stage. Remember, these cavernous sinus contribute to brain venous drainage when it reaches about a year and a half, 2 years of child life. Okay? What Pierre mentioned is venous capture, cavernous sinus capture. Okay? Anyway, so about the 15th week, this is cavernous sinus, what we see, and we have a study developing. This is what arterial system at the time. Okay? We saw this is the ventral ophthalmic artery developing from the anterior cerebral artery. Okay? And then there's a little branch comes from cavernous sinus to ophthalmic artery, and eventually become the ophthalmic artery and portion of a cavernous sinus arteries. Okay? We already discussed that. So, The component which is contained in the cavernous sinus is we call trigeminal, and actually this is just before the cavernous sinus, but trigeminal and primitive maxillary artery, dorsal ophthalmic artery, and sometimes we can see this low origin. It's not a cavernous sinus, but low origin of ophthalmic artery as well. Okay? We discussed already primitive maxillary artery, which is connecting both the right and left side in case of the agenesis of one side of carotid artery. This eventually supplies posterior hypophysis. Okay? And trigeminal artery, we will discuss more details now. And dorsal ophthalmic artery, we saw the dorsal ophthalmic artery. It may replace all orbital contact supply or portion of it. Okay? And this is the one which comes from cavernous segment of the internal carotid artery to the orbit. Rete, we talk about rete. If in section 5 agenesis occurs, and that's what I think it's a rete-like collaterals forms through this proximal to distal segment. Higher splenial artery we discussed, mandibular branch we discussed already. Okay? Reminding you, primitive maxillary artery is more earlier embryonic vessel which regresses quite rapidly. Okay? It may have common origin with the trigeminal artery, and remnant of this is posterior hypophyseal artery and medial clival artery. There's a clival anastomotic channels we'll show you a little bit later on. This is a primitive maxillary artery and immediately regresses and only remaining supply to the posterior hypophysis like this. This is a typical angiographic feature. When you see the lateral view, AP view is difficult to see. AP view, you see the small branch going to posterior part of pituitary gland. Okay, this is posterior hypophyseal artery. This is remnant of primitive maxillary artery. Okay? And this primitive maxillary artery giving medial clival artery. You can see the medial and lateral clival artery. Lateral clival artery is remnant of trigeminal artery, and this has ladle-like anastomosis along the clivus between the right and left side and between the medial and lateral clival arteries. Okay? This is one example which has connection of right and left internal carotid artery, no regressions, but this is just remaining anastomosis between right and left internal carotid artery through primitive maxillary artery. Okay, this is in the cell, in posterior part of the cell. This is where posterior pituitary gland supply remains for them. Okay, we saw this case of agenesis on one side, and which is reconstituting through this primitive maxillary artery. Okay? This is another example of a small, tiny posterior hypophyseal or primitive maxillary artery reconstituting part of this internal carotid artery, which has regressed agenesis of the proximal part of the internal carotid artery. Okay? Trigeminal artery, it develops as primitive connection from the carotid system to the ventral longitudinal arterial axis. This is one major supply to developing mesencephalon and rhombencephalon. Okay? It connects between the superior cerebellar artery in ICA to the basilar artery. But it regresses in week 6, see? And when this basilar artery fuses and vertebral artery establishes. Before vertebral artery establishes, the supply to the ventral longitudinal arterial axis was centropedal, from the central to lower down, reversed. But as vertebral artery develops, it reverses flow from now centrifugal fascias it goes through. Okay? Remnant of trigeminal artery is lateral clival and lateral artery of Caesarean ganglion, recurrent artery of foramen lacerum. These are arteries normally remaining part of the trigeminal system. I show you this picture. Trigeminal artery is major supply to these developing rhomboencephalon and mesencephalon, hypoglossal, proatlanta 1 and 2. However, these are regressing early, okay? And the last one is disappearing, the trigeminal. At the time, this caudal division of internal carotid artery fuses with the basilar artery. Okay? We'll talk about tomorrow more details of the fusion of the caudal division. But when this happens, as trigeminal artery regresses, we often angiographically. You see, this is just a pre-cavernous segment of the internal carotid artery, sometimes a cavernous segment. It connects to this basilar artery between the superior cerebellar artery and ica. Okay? Depending upon, this is actually bidirectional. You can see the carotid artery filling the basilar artery filling the carotid artery through this. Okay? This is just root. Okay? No functional component unless you supply some of the brain structures. This is a specimen Philippe gave it to me. You can see the trigeminal artery which runs this trigeminal nerve. You can see the Caesarean ganglia and trigeminal nerve artery runs that direction. Depending upon the remaining size of the trigeminal artery, the proximal basilar artery caliber can change. You can see this is large trigeminal artery. Okay, you don't need it to carry a larger flow, so the proximal basilar artery is very small. And this is distribution. The basilar artery caliber is as big as we usually see in case of the both posterior cerebral artery supplies. You can see tiny little trigeminal, but large size of the trigeminal artery itself. Okay? Some of the trigeminal artery may be just rudimentary. This is larger trigeminal, and this is tiny little trigeminal remaining. Okay? It may supply just a dural portion, and it may remain as a lateral clival artery. Okay? I do not have an angiographic case, but some of a couple of cases I've seen in CTA, which shows a complete absence of mid portion of the basilar artery. Okay? Proximal artery is supplied from the vertebral, but distal portion is supplied from the trigeminal artery, as you can see in this situation. Okay, and we'll talk. I'm not going into details of these diagrams. I think Siritara will talk about them later on. Okay, trigeminal artery can supply. Okay, without connecting to basilar artery, it supplies ica. Okay, and we mentioned hypoglossal artery can supply ica territories. Trigeminal artery can supply ica territory like this. This is ica territory supplied by the trigeminal artery. Okay, this is another case of ica is supplied by this trigeminal artery. Some of the trigeminal artery may supply superior cerebellar artery. Okay, this is trigeminal artery now giving superior cerebellar artery. You can see that no superior cerebellar from basilar artery. This totally supplied by this trigeminal artery. Okay, some of the cases, okay, may have just part of the the superior cerebellar artery territory. You can see small portion, not complete territory of superior cerebellar. This is a different case, but bilateral trigeminal artery giving to superior cerebellar artery territories. Okay? It can supply central nervous system by this. Some of this, I saw this recently. You can see the trigeminal artery connecting to superior cerebral artery. The proximal part of the superior cerebral artery is not regressed, okay, persisting. So you have direct connection, trigeminal, to the trunk of the superior cerebral artery, as you can see here. This is the trigeminal, superior cerebellar, and distal portion of the superior cerebral artery. Okay? And this is very unusual. This is the first case I've seen. Okay? Trigeminal artery system is embryonic system. So the vascular structure is not mature. It's not matured system. That's why it's prone to have hemodynamic stresses. So you often see trigeminal artery with aneurysm formations. This is two cases. You can see trigeminal artery version, large aneurysm, small tiny aneurysm. Okay. Some may see carotid cavernous fistula filling from internal carotid artery. Okay. Vertebral artery injection, filling same carotid cavernous fistula. This indicates presence of trigeminal artery, retreating, okay, and getting into the aneurysm of trigeminal artery. You can see after closure of a fistula, trigeminal arteries are classified in this direction. Okay. And adult remnant of the trigeminal and primitive maxillary artery is this clival system. Clival system is remaining, as I showed you pictures, medial and lateral clival arteries in anastomosis of both right and left side. And you often see the supply to the dural arteriovenous shunt and cavernous sinus from the contralateral side. This is most often through this clival anastomosis. Okay? This is, you can see, this is posterior hypophyseal artery I demonstrated before. This is where the supply coming from the internal carotid artery to the posterior part of pituitary gland through the remnant of primitive maxillary artery. Okay? This is clival example of one of the clival branch supplying this paraganglioma of that jugula extended to this clivus area. This is where supply can come from. Okay? This is anastomosis between the right and left side. You can see this dural shunt on the left side is supplied from the right internal carotid artery branch, as well as external carotid artery branches going there. And 3D angiogram clearly shows this is a posterior view of left internal carotid artery, right internal carotid artery. You can see these anastomotic channels behind the clivus and between the medial and lateral clival branches and contralateral side anastomosis. Okay? The other rare anastomosis, so this is again clival branch anastomosis. One other cavernous sinus anastomosis can occur through the superior pharyngeal artery, and then carotid branch of superior pharyngeal artery, and anastomosis with a recurrent artery foramen lacerum of internal carotid artery, which can anastomose like this. This is not common, but you can occasionally see anastomosis like this. Okay? This is again demonstration of clival branches supplying the paraganglioma and there. This is good demonstration of arterial arcade along the clivus and autointoid process as well. You can see that. Okay? One other vessel which you may see, not ordinarily you will see, but lateral clival branch of the meningeal branch can come from the cavernous segment to the internal carotid artery. This is going laterally, okay, along the ridge of the petrous bone and reaching the sigmoid sinus at this level. You can see this laterally going, not the medial clival, so-called Bonnisconi Casanari artery, Italian artery is not. Okay? This is the artery which going more laterally along the pistis reaching lateral. And we discussed the dorsal ophthalmic artery already in details, and this is double ophthalmic artery. You saw it, okay? And this is variations can occur, and okay, this is dual ophthalmic artery. You can see both. Okay, I showed you these pictures already. Okay? Sometimes dorsal ophthalmic artery remnant get very tiny like this, and also ordinarily dorsal ophthalmic artery remnant stays as inferolateral trunk. Okay? Inferolateral trunk as branch from the internal carotid artery connects to arteria foramen rotundum, accessory meningeal, and middle meningeal artery. This is the branch. Okay, anterior branch goes to the superior octa fissure, and then foramen ovale, and then foramen spinosum all the way lateral. Okay, so inferolateral trunk is a remnant of dorsal ophthalmic artery. Okay, this is Pierre's drawing showing arteria foramen rotundum, okay, accessory meningeal, middle meningeal anastomosis with inferolateral trunk. Sometimes you may see the branch going to the superior octa fissure to the omen. Okay? And this is example of the inferolateral trunk. You can see filling of the inferolateral trunk through the internal carotid artery and external carotid artery as connection, the accessory middle meningeal artery dominant supply to the inferolateral trunk. This is another example, arteria foramen rotundum and middle meningeal artery, inferolateral trunk. Okay. And basal tentorial artery gain can come from not only from the C5 segment of the internal carotid artery, it can also come from inferolateral trunk. This is inferolateral trunk giving off basal tentorial artery, which runs laterally. Okay, and sometimes inferolateral trunk may reconstitute the occluded segment, occluded middle meningeal artery. You can see the where's my pointer? Okay, middle meningeal artery is now reconstituted through the inferolateral trunk, and foramen spinosum area and middle meningeal artery is filling this way. Okay? And this is an example of inferolateral trunk filling through the arteria foramen rotundum, reconstituting whole internal carotid artery of this. Okay? This is example of agenesis of internal carotid artery, but ophthalmic artery is filling accessory meningeal, inferolateral trunk, then ophthalmic artery this way. Okay? And I think I showed this images discussed already. Okay? This is actually the basal tentorial artery is coming from the branch of the inferolateral trunk. This is inferolateral trunk going to the basal tentorial, filling AVM at the Petrus segment. Okay, at the level right above the petrosal vein of Petrus bone, there's a supply. Okay, one last thing is free margin of tentorium. This is area of Bonnisconi Casanari. Okay, it's a medial tentorial artery or free margin of tentorium. Area free margin of tentorium. It can come from C5 segment of internal carotid artery, or it can come from inferolateral trunk, or it can come from ophthalmic artery as well. This is ophthalmic artery giving off the branch. Okay, this is Philip's specimen, which is showing ophthalmic artery is giving off the tentorial branch, medial tentorial branch of this. Okay? This is again ophthalmic artery is giving off free margin of tentorium artery, and this is actually giving off the originating from the accessory middle meningeal artery. The medial tentorial artery is seeing this. Okay? And I think we discussed vasovasorum already. Okay? Any questions? questions? I'm going to show you a later workshop of the kind of true vessel reconstituting the arteries